Let me ask you about healthcare. Tucker Carlson interviewed you about 6 weeks ago when you were in the middle of healthcare negotiations, and you agreed with him that the healthcare bill wasn't going to help your supporters, that those who lived in rural areas, the older, were going to get hurt by that bill. And you told him, you said, we will take care.
The healthcare bill is going to help my supporters.
Well, hold on, let me just finish the question.
Otherwise, I'm not going to sign it. I'm not going to do it.
Well, this is why I wanted to ask you. You said to Tucker, we will take care of our people, or I am not signing it. You said you were going to negotiate.
Well, that's what I just said.
So tell me what in the bill you've been negotiating to get in that helps your supporters. I'm just trying to get the details of how your people will be helped.
Let me just tell you, pre-existing conditions are in the bill. And I just watched another network than yours, and they were saying pre-existing is not covered. Pre-existing conditions are in the bill. And I mandated, I said it has to be. So we're going to have lower premiums. And before you start there, let me just tell you something. Obamacare is dead. Obamacare right now, all the insurance companies are fleeing. Places like Tennessee have already lost half of their state with the insurance companies. They're all going. Obamacare, John, is dead. Okay, because we're being compared to Obamacare. Just so you understand, Obamacare doesn't work. One thing. No, it's important. I got to compare it.
No, but
everyone's saying about Obamacare.
No, but I'm not. I'm
with
asking about what you're
Obamacare, the premiums are too high. The deductibles are through the roof, so you never get to use it. But more importantly, it's dead.
So, but in the bill, as it was analyzed, there were two problems. One, and you talked about this with Congressman Robert Adderholt, who brought you the example of the 64-year-old, who under Obamacare the premiums would go for 17.
But that was a long time ago, Jen. You're talking about a long time. Totally fixed. How? We've made many changes to the bill. You know, this bill is very much different than it was 3 weeks ago.
Help us explain, because there are people out there who wonder what kind of changes.
Let me explain it to you. This bill is much different than it was a little while ago, okay? This bill has evolved. And we didn't have a failure on the bill. You know, it was reported like a failure. Now, the one thing I wouldn't have done again is put a timeline. That's why on the second iteration, I didn't put a timeline. But we have now pre-existing conditions in the bill. We've set up a pool for the pre-existing conditions so that the premiums can be allowed to fall. We're taking across all of the borders or the lines so that insurance companies can compete
but that's
nationwide.
Not in this bill. The borders is not in this bill. It's in the third bill, right? Because
it's in the second phase. It's called phase 1, phase 2. And that's in fact second phase, which will get approved, which will quickly get approved. But let me just explain something. There will be such competition. Right now, there's no competition. There will be such competition by insurance companies so that they can get health care and the people taking care of health care. So, the other thing we're going to have is groups. Groups of people can negotiate. What's going to happen is the competition is going to drive down the premiums, in my opinion, much, much more than people understand.
So what you've just described is the bill that you previously had said you worried wouldn't help your people. And here's why I ask. You said pre-existing
No, there were
conditions.
things in the other bill, the first version, which were not as good.
Okay.
But when I watch some of the news reports, which are so unfair, and they say we don't cover pre-existing conditions, we cover it beautifully.
Although,
I'll tell you who doesn't cover pre-existing conditions: Obamacare. You know why? It's dead.
In one of the fixes
it's not going to be here.
In one of the fixes that was discussed, pre-existing was optional for the states.
Sure, in one of the fixes, and they're changing it and changing
so it'd be
it.
permanent.
Of course.
Okay. Well, that's a development, sir. So you're saying it's going to be pre-existing for
John,
everybody?
This has evolved over a period of 3 or 4 weeks. Now, we really have a good bill. I think they could have voted on Friday. I said, just relax. Don't worry about this phony 100-day thing. Just relax. Take it easy. Take your time. Get the good vote and make it perfect.
Just to inform.
But we're going, most importantly, we're going to drive down premiums. We're going to drive down deductibles, because right now deductibles are so high, you never, unless you're going to die a long, hard death, you never can get to use your health care because the deductibles are so high.
Okay. So what I hear you saying is pre-existing is going to be in there for everybody. It's not going to be up to the states.
Pre-existing is going to be in there, and we're also going to create pools. Okay. And pools are going to take care of the pre-existing.
On that crucial question, it's not going to be left up to the states. Everybody gets pre-existing no matter where they live.
No, but the states are also going to have a lot to do with it, because we ultimately want to get it back down to the states. Look, if you hurt your knee, honestly, I'd rather have the federal government focused on North Korea, focused on other things than your knee, okay? Or than your back, as important as your back is. I would much rather see the federal government focused on other things, bigger things. Now, the state is going to be in a much better position to take care because it's smaller.
people out there with pre-existing conditions, they are worried. Are they going to have the guarantee of coverage if they have a pre-existing condition, or if they live in a state where the governor decides that's not a part of the health care, or that the prices are going to go up? That's the worry. The American Medical Association says
we actually
it could
have
effectively make coverage completely unaffordable for people.
We actually have, well, forget about unaffordable. What's unaffordable is Obamacare, John.
So I'm not hearing you, Mr. President, say there's a guarantee of pre-existing
We
conditions.
actually have a clause that guarantees.
Okay, excellent.
We have a specific clause that guarantees.